Thank you all for having Harris County Public Health be a part of this presentation. And I really want to start by saying a couple of quick things. First, as you can imagine here in Houston, Harris County, we're watching not just COVID-19, but we're watching what's happening with Hurricane Laura, which is set to make landfall this evening. We certainly are also watching all sorts of other related issues with that. So with that, I wanted to give you a quick piece on what we're doing here at Harris County Public Health. So you see this this concept of mapping the curve, and I do want to talk about that in a little bit more detail as we go along. Feel free to follow us on Twitter and social media, and I will bring up this concept of the hashtag Invisibility Crisis, which I think is one of the challenges with public health in general. So as you know, Harris County is big, it's diverse, it's complex in every sense of the word. We are population-wise, we rank in sort of the order of Kentucky, Oregon, number 25, 26 in the nation. By population, we're spread over the size of Rhode Island and actually just smaller than Delaware. And we're one of the most, if not the most diverse communities in the country. And so it really brings an incredible amount of energy and complexity to the work we do. We are the home to the fourth largest city, Houston, with 2.2 million people there, but there are 2.5 million people outside of the city of Houston as well. When we look at GIS for COVID in particular, we really see this as what Esri has really formulated, this framework for how to bridge this divide between numbers on a page and really most importantly, what are the insights this data provides to communities like ours. And as you see the statement from Esri below, from our standpoint, it's very much about all of the different activities that allow us to focus and accentuate both internally as well as externally the work that we do and why that work is important, but how do you also visualize that for the community at large, including our partners. The process, as you can imagine, really is very important as much as the end result. And it really moves from resource allocation. And as we started our activation, in fact, our activation, we sent our first health alert out January 9th, and our team formed January 23rd. That activation ramped up in March when we had our first set of cases, and that has really grown to this real customizable piece of the response as it continued to grow. We recognized very early that our current system, or at that time our current system of data collection and management, was just not customizable enough, adaptable enough, and so we created in-house, and really kudos to Michael and his team for developing what we called a COVID-19 response system and response program system. And that CRP really was the culmination of collecting of multiple streams of data, including COVID case counts and testing data and contact tracing, et cetera, and automating that. But really it was then what we thought that data can only get you so far. It was not just flattening the curve, but mapping the curve is the way we were looking at it, and how we could really then visualize that in a way that was going to allow us to be successful. That dashboard is now on our website, and thank you again to Esri for this. As you know, a lot of dashboards around the country have very similar things, but just to let everybody know that dashboard from our standpoint includes the confirmed number of cases. We actually now have over 100,000, unfortunately, and all the other demographic information, as well as the COVID-19 threat assessment level that we have in our county, and we have it by zip code in terms of the confirmed cases, and the cases by from an epi standpoint. And then if you look at the very bottom, ways that people could get tests, self-assess, Texas data, global data, our test positivity rate, race, ethnicity, zip code, and additional city data, because we have obviously Harris County as a whole, but also the large city piece as well. And a lot of that gets us to really sharing the knowledge and insights to the community at large. And that is really very much a part of what we want to do then, is not just responding and having internal information, but how do we provide updates to our community? How do we engage our community, and really making sure they know how to get tested, and really very specific information about demographic, if you will, from zip codes to also the race, ethnicities, and other demographics that really come to fruition for our department. But it's really about decision making, right? Data is really data, but at the end of the day, it's how do we actually bring that together so we can make the decisions, we can make the real key, let the key indicators help drive our decisions, and that we can also think about communities that may need to be thought of in the midst of our ongoing response, and how do we do that in a robust way. That decision making is absolutely critical to the response, because we don't want it to just be data free. We want it to be informed by data as best we can, even though we know that data, having good data or really information or metrics has been challenging throughout the COVID-19 response. And it's also about insights. It's analyzing that information, and really at the end of the day, allowing us as well as partner agencies to identify the relationships between these disparate data sources. So for example, here we have the top 10 confirmed cases by zip code, and then on top of that, we have some of our additional information for Hispanic populations. And so that really then gives us more rich information for outreach engagement, and certainly a community that is very important for us because of the inequities that we're seeing in the COVID-19 response for cases, hospitalizations, and deaths with our Hispanic community. We want to make sure we can then map it and then respond to it. Also, the concept that we coined was really this testing deserts, like food deserts, testing deserts that really allow us to be looking at where we have less testing. As you can see, we want to make sure that we then can look at that with the social vulnerability indices that the CDC has put together, which is on this map, and the SVI together with that index along with the number of cases. So we are then able to look at poverty and housing and transportation, all those vulnerabilities, and pulling those in place with zip codes and also where our testing is. And so we can then look at cases, testing, and the SVI, and bringing that together in some very meaningful way from a data visualization standpoint. That doesn't mean it's just our information, right? We've also added in information from partners. This is a regional advisory council, CETRAC, Southeast Texas Regional Advisory Council, and they've been noted across the country for some of their incredible work that they've done in emergencies, including right now as Hurricane Laura comes our way. And so they've been monitoring the number of beds and other metrics in the healthcare system. So we then are able to link that into our dashboard and our information that we put out there, and then really identify ways that we can get into the resources and capabilities within the healthcare system, and also be aware of those challenges that then dovetail into public health. Obviously, it's markedly more than maps. It's really integrating it with other systems and having this real flexibility, automation, and then streamline approach that really allows us to take out of the box and custom options, and really delivering content for public as well as internal consumption, which I think really helps us then connect on these recurring trends that allow us to find patterns and pattern recognition for us to be able to move our work forward. And that includes, as you can imagine, web and mobile surveys and activities that really allow us to do some things internally as well as information externally. And some of those then allow us to automate that information, but also approach it from an inside to outside approach that allows us to really be thinking about how does this information come together from an integrative standpoint. That then, as you can also imagine, and I've talked about earlier, but the dashboards really allow us to really share that information, but we have to remember that those dashboards are a culmination of all the information that we are putting together. So tracking the KPIs, very important for our internal teams, but absolutely making sure that that information is available to the public as we want to make it in a meaningful way, so that the public can then think about the kinds of things that we're trying to do internally, but also how does that make sense? What I call it is collecting the dots, but then most importantly, connecting those dots, which I think it absolutely becomes critical to the piece. So WebMap and these apps are very important, and as you can imagine, our team is working on things integrating R and Python with GIS technology, and I'm so glad I don't have to explain that because we don't have enough time, because that's well beyond my area of expertise. But again, that's what our teams are very good at doing, is potential of these new tools being developed as this response continues to evolve over time. And certainly, I've mentioned this before, the mapping the curve so that that information now becomes what we're doing with testing, what we're doing with epi investigation, what we're doing with outreach, what we're doing with contact tracing, what we're doing with engagement, and visualizing that in one succinct way for our community. It reminds me of the fact that, as I mentioned, this hashtag invisibility crisis, that we are oftentimes invisible in public health, and we have to raise that visibility. That when you raise visibility, it creates value. When you create value, there's validation with pro-health resources, pro-health policies. Certainly, we didn't think that the fourth V of virus would be the way that you actually elevated the visibility of public health, but that's how you fight the invisibility crisis. We are the offensive line of the football team when everybody is focusing on the quarterback, and that's where COVID-19 has really brought it to light, the importance of the work that we do. So let me close by saying that public health just makes common sense. This picture on the right is from 2005 when I had hair and it wasn't gray, and it was really an official form that I put into the Hurricane Katrina response at the Astrodome that asked for common sense, and that has stayed with me throughout all of this time, because at the end of the day, it takes a village, whether it's here or in Haiti, in the midst of a earthquake response. I tell you, it's all about what we're doing for our communities and the importance of that. And this is our executive team, and they've just been fantastic, and really holding our Harris Cares report from 2019 that highlighted the importance of a 10-year roadmap for health in 2020 and beyond. And that's what GIS gives us. It gives us this capability that's not just about pre-COVID-19, not just about COVID-19, but even beyond COVID-19, what does the future look like for us?
So I've only been with Harris County for a short time now, but I know from what I've seen so far, it's, I guess, the ability to integrate all of the systems that we have. So Harris County is in a unique position where they've become masters at responding to hurricane issues and crises. So that is just kind of spiraled into, I guess, the viral infections and whatnot. So being able to bring systems on board quickly, connecting to other organizations, integrating all of the databases that we have, and that's been essential in how quickly we've been able to do everything with the response so far.
Yeah, and the only thing that I would just add to that, what Jennifer said, is that it's pattern recognition of the emergency that's upon you. And because you've seen it before, because you've got the systems in place, then to recognize what you anticipate, what's about to happen. And that's when the resources start to come in, including from the technology standpoint, to say, how can we make our jobs better, easier, faster? And then be able to to really leverage that experience and that technology and that know-how to then anticipate what those decisions are that you're going to need to make based on that. And that's been really critical for our work.